I want to move, if we can pivot, just the issues of COVID and housing. Olivia Amadon is a social worker at the Dimmick Center in Roxbury, and her clients are primarily Black and Brown. Many of them are frontline workers, they're cleaners, service people, et cetera. And she's really worried about this issue of isolation and the mental health of some of her clients. There's also the health barriers, right? Or rather, the language barriers that they face in getting information, not just any information, but good information. And of course, there's their living situation.
One of the biggest things that I see having an impact is housing, and the lack of affordable housing. My clients who are on wait lists for affordable housing are going to be on those wait lists. They've been on them already for 5 years, and they're going to be on them for probably another 5 or 10 or 15 or who knows. And that has an impact on their health, right? It has an impact on the fact that they have to make a choice between paying a rent that's 75% of their income, or staying home with their kids and making sure that their kids are safe.
Tanisha, if you want to jump in on this, how big of an issue is this, where the housing issues that some people are facing further puts them behind, puts them in a hole?
Absolutely. I mean, housing is one of our greatest challenges here in the Commonwealth. That was even before the COVID-19 pandemic. We really do have to become, I think, even more progressive in our housing policies. The fact that we have cities where the wait list for affordable housing is years long is just completely unacceptable when we have towns and other cities surrounding the urban core that have plenty of space. And so what that means, Dan, is that, again, here we are in this moment where, folks are saying that they now see that there's racial injustice and they want to know what they can do. I would submit that, in cities and towns across the Commonwealth, we should be having meaningful, deep conversations about our zoning laws, for example. We should be having conversations in cities and towns across the Commonwealth asking, look, if you live in a town that does not have affordable housing, and I'm not talking about, 3 units, if you're living in a town or a city that doesn't have affordable housing that is, safe and accessible, the question needs to be why. And we need to really have, again, honest conversation about why it is that so many cities and towns have resisted really doing their fair share to make sure that all of our Massachusetts residents have access to safe, affordable, environmentally safe and affordable housing. And that's something that each of us can be doing.
And I know, there's been the fear in many communities, inner city communities, about evictions, right? And, are they going to be thrown out because the jobs, the low-paying jobs that they did have went away and they can't afford to pay their rent? And I guess a little bit of yesterday, Governor Baker, just extended the moratorium on evictions in Massachusetts until October 17th. So that's good for all residents of the state, but certainly for those people of color. I want to bring in some questions from our audience members. David from Boston asks, I am most concerned with nursing home workers of color who do not have access to adequate housing, medical care, or transportation, who often are forced to work at several facilities in order to survive. What steps can be taken to ensure the safety of these workers and thereby the inhabitants of these facilities? Dr. James, you want to take that one?
Well, I think it would be helpful if we had some standards. I don't believe that there are standards across the various different nursing homes in terms of what kind of safety measures are in place in terms of like PPE and that type thing. I've talked to different people, who have had some insight into that. And from what they tell me, there are no standards across the Commonwealth for those places. And so I think we could start there, because the 60% of the of the COVID deaths that happened were in nursing homes. And I think that's a major problem. So that's something that we definitely could address. I don't think it's that difficult, to create standards. Like we have standards in hospitals and community health centers. I don't understand why we can't also have them in nursing homes.
Adrian, Paula from Hull, Massachusetts, asking, how can our predominantly white communities make the necessary changes towards combating segregation in education and housing, given the embedded structures currently operating that created these circumstances?
It's not all about embedded structures. I mean, there are state laws about affordable housing that have never been followed or enforced, and that suburban communities have found a way to get out of for 50 years. I mean, this isn't necessarily about dismantling an entire economic system. It's about passing some laws and forcing suburban communities that have resisted to follow those laws. And I think that's an eminently achievable goal.
And then one more question from our audience. Malika from Hyde Park is asking, are there any special resources set aside for Black people in the city of Boston to be able to purchase homes to stay in the city? Anyone want to take a stab at that one?
Sure. So prior to COVID-19 and even through the COVID-19 pandemic, there are affordable housing, home ownership programs that are offered both by the city and also through mass housing. So at the state level as well, that provides support to individuals who want to be able to own a home. That's actually one of the things that I think we need to talk more about. When we talk about affordable housing, I think it's important for us to make sure that the conversation is not just about rental units, but that it really is about home ownership as well. We have to remember that from a historical perspective, one of the ways that really a cornerstone within our country to build wealth is through home ownership. Of course, the Globe Spotlight series highlighted this back in 2017. And also, the Color of Wealth study also shows, the net worth of a wealth of a white family in the city of Boston, $247,500. That of a Black family is $8. A lot of that is in home ownership. So we really want to get to the point where we start to dismantle, disrupt, and or have the power to really help enforce some of these laws that are on the books. We really have to work on the building of wealth and programs that support affordable home ownership, I believe, is key. I
think there's another
I'll come back to you in just a moment there, but when you talk about have the power, what did you mean by that? Like, how do you get the power for something like that?
Yeah, so we do need to have a conversation about power. And Adrian just lit up because this is his thing, We do need to have a conversation about power. I mean, what you heard even in Council Jackson's story, his story about his experience with COVID-19. We've seen it in other situations as well. Those who have access to political structures, those who have access to financial structure of power, here in the city, across the Commonwealth, across the country, are oftentimes able to move systems, to move policy, to move legislation in a way that others are not. And so part of the work that we have to do in this moment, and certainly 2020 is showing us this, is that we need to have real conversations about power, what it looks like, who has it, how it is taken, and being very clear that a key lever in that is voting rights and access. 2020 is going to be a big year. And as we're having conversations about racial justice and racial equity, voting is absolutely a key component of that. Who we're electing at the municipal level, at the state level, at the federal level matters. They're the ones who made decisions about who got testing and who didn't get testing. They're the ones who make decisions about whether certain policies or legislation or laws are going to be enforced and how. So voting is absolutely a critical part of this conversation.
Adrian, since Tanisha said that you just lit up, go ahead.
When we talk about voting, and you're completely right about this, we focus so much in years like this on the presidential election, right? But it's also important who we're electing to local office and who we're putting in the state house, because that's where a lot of this is happening. Those are places where our communities should have a lot more power to